gives me great pleasure to introduce our friend Margaret Foster. She is the Evidence Synthesis and Scholarly Communications Librarian and the head of the Center for Systematic Reviews and Research Synthesis at the Medical Sciences Library, Texas A&M University. She is the co-author of the first book written on systematic reviews for librarians, Assembling the Pieces of a Systematic Review, a Guide for Librarians, and recently published Piecing Together Systematic Reviews and Other Evidence Syntheses. She received the Presidential Impact Award from Texas A&M University in 2018 and the Lucretia W. McClure Excellence in Education Award in 2024 from the Medical Library Association. So thank you, Margaret, for being our guest speaker for the series and sharing your expertise. So now I'm going to stop sharing my screen and turn everything over to you.
Thank you. Let me get kind of switched over here. So thank you for joining us this afternoon. I'm so excited to be here with you and share these slides and talk with you and hopefully share some examples with you that will help with these phases and things like that. So today we're going to be focusing on the proposal, and the main part of the proposal is figuring out what is the scope and rationale for this review. And so my objectives are to talk through some steps, and really they're like action steps that you can do with your clients to figure out the feasibility of their review. The hardest part being matching the review to their question, listing those topics that need to be covered in the initial reference review, and then hopefully along the way detailing how to help your client figure out what's the rationale behind this review. Okay, so here we go. There we go. So my agenda for today, I'm going to do a quick recap of what we did in the introduction to this series. And if you missed that, you can go back and I go over the whole pieces framework there. I'm just going to talk a little bit about it here. Then we're going to get into specifically the phase one. And then I kind of divided that into three parts: the planning, the preliminary searching, and then bringing it all together. In between, we'll take a brief, like 3 to 4 minute break, have you try out a little tool, and we'll see how that goes. Okay. So the last time in the intro, I spent several minutes of that introduction talking about different review types. And I gave this article, which I think this is one of those kind of quintessential articles to read. To me, this kind of replaces the article that people used to cite all the time from Dr. Booth to the typology of reviews. This is really about review families, and it goes over this kind of explosion of reviews that's happening right now. What's really nice about that article is it also goes over the associated like retrieval requirements for each of those, some of which are not standard. So if you haven't checked that out, check that out. Today, I'm mostly going to be talking about systematic reviews and scoping reviews as like the biggies that people ask me about a lot. But last time we did talk about more types as well. Last time we also talked a lot about that evidence that shows the librarian's impact on the quality of reviews, especially, of course, around searching and the search reports. We talked about clients' needs, and we also talked about potential roles. And of course, throughout this series, we're going to be talking about that as we go over each step. So this is kind of an all-encompassing picture of the review cycle that I call pieces. And what you see around the outside are the phases. So today we're going to be talking about the proposal, and you can see they're kind of at the top of the cycle. This has the symbol of the light bulb light. This is where you get the idea, right? And so this may not be a formal proposal that you turn in to anybody or have to write up, but these the step is still really important to get this part done before moving on to the protocol. And many times I'll have clients that want to really rush through this step. They want to think about doing reviews in a very linear fashion. And it's really important not to do that. If you're trying to do a systematic review, a scoping review, integrative, those types of reviews, it's really important to take the time to really formulate and figure out, is this feasible? Is this going to work? And so I designed the series to go around these phases here. So today we're going to be talking about the proposal. Next time we'll talk about the protocol, and then production, which is the majority of the searching, but it's really that translation from the main search. Then get into the paper and reporting and things like that. And then our last day, we'll kind of zoom around the circle and talk about the things that you can do after the review is published. And we'll also talk more about working with clients as well. So each of these phases has the potential for some type of scholarly output, a report that can be done. Those may not be, as I said, formal, and they may be multiple as well. So on this slide, I'm trying to show like the main questions or the main work that you're doing with each phase. Oh, I forgot to mention, why is it called pieces? The pieces part there is in the middle. So these are the processes. And for each phase, you work through these processes. And so that's the plan, identify, evaluate that's listed there. And so what we're going to do with the series is I'm going to go through each of those processes for the phase that we're talking about. So I hope kind of bring it all together. Okay. So in the proposal phase, like I said, we talk about what is the review type, what's the scope of the review, the protocol. You figured that part out in the proposal. Now the protocol is you're going to focus on the methods, and of course sometimes those need to be registered. We're going to talk all about that next time. And then you get into the production. So this is okay. Now they're in the middle. They're running it. Where all do you search? When do you stop searching? That kind of thing. And then the paper. And so that's going to follow the organization of our series. So what are the steps for the proposal? So in the beginning, most of the time, and what we're going to talk about the most today is the planning. And this is where we're trying we're listening to what our client is saying about their question, what they're interested in. We're trying to figure out what is the review type, what's the purpose of this, and trying also to frame the question. And I put a 1 and 2 here. Sometimes they kind of mix a little bit because you have to learn a little bit more about one to figure out the other. So even though I put them in that order, they don't always go in that order as well. But that's how we'll do it this time. And then during the identify through combined stages, this is where you're doing some of those preliminary searching. It's really important to look for related reviews. And if there's a lot of those, they really need to consider those. So I'm going to give you tips of what I do and working with clients around those. We're going to get into scoping searches. Next time is when we're really going to focus on designing a really well done search. Today, I'm just going to talk about it in general. And then we're going to end up today talking about pulling it all together and what else to talk with your client about. So let's get into the first part here, the planning stages. So this is where, you're trying to listen to what's happening. You're trying to ask them lots of questions to figure out that review type, to frame their question. And so everybody's got their own style of doing this. Sometimes, my client will come and they'll say, oh, I would like to do a systematic review. And one of my first questions to them is, well, what's your definition of a systematic review? Sometimes they feel very unsure when I ask them that, and that gives me the opportunity to kind of talk with them about the definitions, and we're going to go over those in just a second. But you really want to make sure that you're both defining it in the same way. I have had times when I meet with somebody and they think the term systematic is more like an adjective instead of a specific method that they're going to do. Of course, it's also good to find out right away and set realistic expectations on time. Um, and then clear, you want to have clear expectations of what you're going to do and what you expect from them. Sometimes if they feel really unsure and they want to know more about that, that's what the opportunity to give them some articles on study types. And throughout this, I've tried to give you clear citations to those things that I use and that will help me. So I'll be sure to point those out to you. So systematic reviews. My definition is listed here. And another way of saying it is just to say it's a study of studies. That really differentiates it from your traditional review, which is more of an overview. Another way is to think about it as like a book chapter, that kind of a thing. So I usually try and start with what is a traditional review where that scope can change throughout. It's very exploratory. No methods are given. So I kind of talk about that part of it as that's where systematic reviews are really going to vary. Sometimes when talking in the definition, people talk a lot about what I have listed under a well-done review. They talk about, systematic reviews have a comprehensive search, they minimize bias, they're transparent, and all of those things are true of a good systematic review. But it's important to use the definition as well, I think, in order to help them to understand the difference. Because you could have a scoping review, integrative review, all those other things have those characteristics as well. And this is what differentiates systematic reviews. And we're going to do some more examples here to kind of help with that. Sometimes people confuse meta-analysis and systematic review, and they think they're almost like synonyms of each other. And one way to think about it is meta-analysis is just math. You will see them a lot in the literature, but not always. So sometimes somebody has done 5 or more studies. I see this done in education more than medicine, and they want to bring the some outcome together across those studies, so they'll do a meta-analysis for them. So the systematic review is all the work that's done to bring the studies together and analyze them. And meta-analysis is just that math where you're combining an outcome together in those studies. And of course, this is one of the more rare types of reviews because you have to be able to treat those studies as if all the participants were in one big study. And most of the time interventions are just too heterogeneous or they're too different from each other in order to do that. And now we're almost at the very end of my understanding of meta-analysis. So there's been times usually when I have to send my clients to go talk to somebody else and I can suggest like books or other tools for them, but that's the end of what I do for them. But I wanted to explain kind of the differences between those two here. So sometimes somebody wants to do a systematic review, but when they're describing what they want to include, it's too variable across. They want to look at like different perspectives on the topic. The question is kind of broad. Sometimes there aren't that many studies out there on the topic and there's no right number, but sometimes a group will say, oh, you have to have at least 5 or something like that. And so they need another tool and another method or something to do. And that's, of course, where the scoping review comes in. So here I have an article that is a great helper for deciding between those two. And so I tried to help kind of summarize what the article says. Of course, it goes into a lot more detail. And so systematic reviews are when they have a very specific question and they're going to specify, doesn't necessarily have to be the same study type, but it has to be coming at it from the same perspective. And then when you get into the scoping review, this is where your criteria can be much more open, can include a wider range of study types, of perspectives, things like that. And I use these pictures over here of fruit. Sometimes this helps using this analogy that with systematic reviews, it's all apples. They can be different color apples, but it's all apples. And then that's where you're able to more synthesize the results of like data extraction. Like you can really compare those studies closer to each other. Whereas in a scoping review, this is much more open and you're more describing the different fruits that you found. You can't answer a research question with a scoping review like you can a systematic review. So I hope these help. And so I think about reviews as being on a spectrum, and I tried to put some lines here showing when it's starting to differentiate and perhaps go into another type. So you have your traditional reviews, your overviews, narrative reviews, lit reviews, all those kinds of things. They tend to be more subjective. The format, of course, can vary greatly. And they can start with one scope and then at the end they change to a different scope. And that's all, part of that process. And then reviews with frameworks, what I mean by that is these are reviews that they have their steps out there and they're designed more to walk the author through a series of steps to describe to the reader what they found and what they did. And some of these, of course, like the scoping review, have a standard associated. When we start getting into reviews that have studies that are answering the same research question, that's when you're getting into the realm of systematic reviews. And then to go even further, are those studies are very much alike. And that's when you can bring it down to the meta-analysis. Some things do kind of fall into that gray area from time to time. So that's why I consider it more of a spectrum than always like a hard stop. So some techniques here. So sometimes I have clients that are kind of in between. And so I have to ask them, what's most important to you? Is it you want to conduct a systematic review and you'll change the question in any way that you need to make it a systematic review? Or is it that you want to answer that question and you're more sort of shopping for a review type? That really helps me to understand where my client is coming from and what would best match for them. There's many categories for reviews as well, and we're going to be going over some of these today. You can think about reviews by the type of study that they include. So quantitative, qualitative studies, or even umbrella, which would be they want to include systematic reviews in their systematic review. And I know I've seen now systematic reviews of systematic reviews of systematic reviews. I keep wondering how far out we're going to get on that list. So they came up with this term of umbrella reviews for those systematic reviews of systematic reviews. We could think about them by time. So there's rapid reviews and now there's standards for those. How they need to be reported, what they are. Living reviews, I kind of think about Cochrane reviews like this in a way, in that they're updated on kind of a regular basis. But living reviews is basically the authors have told you, oh, we're going to update this on this time schedule, and you will know like the triggers for when it will be updated, kind of a thing. They can also be categorized by type of question, and I have a couple of slides coming up about this, but effectiveness, this is where you see a lot for the Cochrane collaboration focuses on clinical effectiveness questions a lot, but they've started to branch out a little bit. You can look at economics questions, prevalence, different ones. You can also categorize them by the type of synthesis they do. So we talked a little bit about meta-analysis. There's also qualitative. There's a network meta-analysis. And then one of the rarest, I think, is the Bayesian. Don't ask me too many questions about that one, though. You can look it up on that article I showed you at the beginning. Okay, so now hopefully we'll get into a little bit of trying out some of these definitions we talked about. So here's a question. What is the current literature on accessible design policies and library settings? Which of these review types do you think that question is kind of framed for? And you can put your answer into the chat. Okay, I'm getting lots of answers here. This is great. So the way that I framed this, I was trying to frame it mostly for scoping, but if you said narrative, that's not wrong. There are, I tried to kind of put the typical way I see things phrased. Is there any word that kind of made you think, oh, that's scoping? Or is there any part of this that kind of hinted towards that? Literature, current literature, that's great. So what I like to do when I go into classrooms is whatever their specialty areas, dentistry, nursing, anything like that, I try and think of a series of questions kind of like this, and I try to put in the typical framing of the different types of reviews. And then I ask them, okay, what made you think of that type? To kind of show to others what we were thinking about. So, and you're right, it's also a broad question, so that's great. Okay. Next example. Okay, great. Most people are writing narrative. So what in there made you think about narrative? That was a good guess there. Yeah, that term mean. So if a client came at me with this kind of a question and I saw mean, no matter which other type we turn this into, and any of these could be reframed into any of the other ones, I would still want to know, like, what do you mean by mean? But of course, that is very subjective. Okay. And one more. I should say, what are the impacts of library outreach programs during freshman orientations? So, what are you thinking there? So maybe you're thinking it might be systematic. I think we might have to have a little bit more information to figure it out if it's systematic. But it does have a little bit more detail maybe than the other questions that we've had. And so I wanted to use these examples from our own literature here to think about, like, how would you reframe it and what would you do to turn it into yeah. Okay. So you might have to be a little bit more specific about the impact or the type of outreach program. You might have to do a little bit more to be more clear. So, okay. So a few tips on listening here. So first I'll kind of ask them to kind of state their question. I'll start thinking about, like, is that appropriate for systematic review? Would that make sense? Is there another type that might make sense? Does it have the elements of a certain framework? And we're about to go through several kinds of frameworks, but thinking about PICO and other frameworks, does it kind of match one of those? And any question can be reframed into another one, given working with them and answering more questions. So any of those that I just showed you could be turned into any of the other types. They were just examples to get you thinking here. So in framing the question, I start thinking about, okay, what type of question does that best fit? What's the eligibility criteria? What do I need to ask them more about? And that question becomes the basis of every other decision moving forward. So if this question changes in any way, we've got to go back to this step. And that's why I think working through the proposal and these steps are so important, and the protocol as well, because you want to make sure like everything's going to work before you go and try and find everything and they do a lot more work. Okay. So more about the reference interview. So after I've kind of gotten from them the question and we started talking about, well, maybe that's this review, that review, I'll start trying to ask them more information. So I might use the term eligibility criteria. Sometimes if they're really new, I might use the term like, tell me the characteristics of a study. What kind of study, that kind of thing, kind of get them talking some more. If it's a really broad question, I might start wondering about, okay, what kind of limiters might you be putting on this? That kind of a thing. And of course, the big one, like, hey, do you have any great examples of things you've already found? I should have added that on here, but that's another good question to ask, because if they already have something, that's, of course, a great helper. So the next two slides, I'm going to be showing you 10 different frameworks. And the most important thing to know is there's an article that sums up these frameworks. It has a great table in it. The table actually has more than just this in it. It also has an example question and an example study that matches that. So I'm showing you this for the most part to show that there's a lot more than just PICO out there that can be helpful. And I have found that table to be so helpful from this article that I like to share this with students when they're trying to come up with their question and to show them those different options that are out there. In my practice, of course, I see plenty of PICO questions, but PEO is one of the most common, and that's where you have a population and exposure and outcomes. Of course, I also work with a lot of public health folks, so that kind of fits in there as well. Prevalence is kind of moving up in how often people want to conduct a systematic review on a prevalence study. And then here's some other types. I myself have done several focusing on a method. I think the type I'm least comfortable with might be the economic ones. But of course, I don't have to actually conduct it, right? I can listen to their question and I can use that there. The PICO framework, though, it looks a lot the same as what you're already comfortable with. So like I said, this article is great. There's a table there, kind of sums it all up. It's a really good tool to use when you're working with your client. Now, if they are choosing to do a scoping review, that framework is going to look a little bit different. Sometimes people still use the PICO framework. I think especially if their scoping review is on interventions, they might still do that. But this is this suggested framework for scoping review. This is from the JBI manual, and it's divided into the population, the concept, and the context. And context is one of those that I've learned over time is optional. And so this has sometimes a little bit tricky for me when I'm trying to like figure out like, where do I put which element kind of thing? What I've learned is that the concept is really what's most important to them, to what they're looking at. That's kind of the starting point of this framework when you're thinking about like, where do the elements go? And so now we're going to do an example here to show taking one question, how this can be framed in different ways. That I put two different PICO questions here, and then also a PEO, a population exposure outcome question, and then even a scoping review to kind of show how you could take one question and change it here. Even though I know I just put effects, you can imagine like a more specific outcome there, hopefully. So the first PICO here is thinking about vitamin D as an intervention, and that you're just looking for randomized control trials. that could be one way of framing this question. And of course, for your outcomes, you probably need to be like BMI change or something like that. And then for PICO 2, this might be that they were looking for cohort studies and they wanted the studies to follow people over time. So those are those studies where they might go on for a year or more, something like that, to see more of that longitudinal effect of an intervention. Um, and then when we go to the next column, the PEO way of looking at this, this is where you're trying to just kind of do a snapshot, and you might be looking at maybe a broader population than just the population with obesity. Maybe it's a survey of a certain group or something like that, and you're wanting to see how much are they taking vitamin D supplements or something like that. And your study design there might be surveys. So here I was just trying to take one question and show how you, with a framework, you could do a lot of different things. And then in a scoping review, maybe you want to take a broader view of this topic. Maybe you do have a certain context, or maybe you want to see what research has been done on this to kind of help figure out where to go next. So sometimes people use scoping reviews to determine research priorities, different things like that. And most of the time, scoping reviews don't set a certain study design. Okay. So for this slide, I wanted to talk through, well, maybe it might be good for me to see the Q&A. I think we're kind of building up a little bit in there. So how are we doing?
Hey, Margaret, we have about 3 questions.
Okay. So I think we might, what do I send them home with? Don't understand.
Take your pick.
Fun. Okay, I love the way these questions were framed. Okay, so your first question about what do I send the team home with? So we're going to get into some like action items that you do. So it kind of depends how far along are they in their question. And so I might do at least one of the search techniques we're going to talk about in the next steps before I send them home. So it kind of depends like how long have we been talking, all those kinds of things. So today's steps that we're going through, you might do over a couple of meetings, or you might try to do it all in one meeting. It just depends on you and your client. So in that first meeting, I might send them like, oh, you're thinking about scoping review. I might try and find a couple of reviews on their topic, and that's going to be our next step. So that's a good question. And with some services, people ask them to come to them with a protocol already, and then you might spend that time kind of working with them. I try and get clients before they've got to the protocol stage for the most part to kind of guide them along the way. When they want to review and they don't know what it is, this happens, of course, all the time, right? They're either told to do a systematic review, they've heard of them. And so this is where I think that next step that I'm going to show you about showing them examples and talking through is going to be a big help. Okay, and then they have a list of specific articles, and they want to make sure that's in the search. So of course that happens a lot, and it's actually very useful, right? If they give us some specific studies. So your question, I could come at from a couple of ways. One could be if they gave me a list of studies and they said, oh, I want to make sure that these come up, but I look at the list of studies and they don't seem to match their eligibility criteria, then I'm going to ask them questions about that. If they're like, oh, I only want the search to bring up these and try and make it as narrow as possible, of course, that's a big problem. And I've had that once or twice. But if it's more about, hey, can you make sure these come up in the search, then that's going to be a big benefit. And we're going to talk about this a lot in our next, when we get together next, because that's going to be one way of evaluating your search. So we're going to talk about that a lot then. So I hope that those answers kind of helped y'all there. Okay. Oh, went too far. Okay. So this is a very busy slide. So we're going to spend several minutes talking about this one. In the slide deck that I sent out to everybody, this is the only slide I changed. So what you don't have on your slide deck is going to be the pictures. I thought, maybe I should put some examples of what I'm talking about here to make it more clear. So the table and the pictures on the right side is what you would be missing from the original slide deck. So I thought I would take a few minutes here and talk about the difference between eligibility criteria, the search criteria, and exclusion labels. This is something that my clients get really confused about. And so when I'm asking them questions, sometimes they give me strange answers. And so it's something I go over a lot with them. So the eligibility criteria is that list of characteristics of what it takes to make it into their review. And of course, in systematic reviews, it's very specific. And then if we were doing a scoping review or another type, it may be a little bit more broad. Within that, you might divide things into inclusion and exclusion criteria. Where the confusion starts to come is sometimes they take all of the inclusion and they just write it the opposite way and they say, that's my exclusion criteria. That's not in the eligibility criteria. Exclusion criteria is not really meant to be done that way. And what's happening is they're confusing exclusion criteria with the exclusion labels, which we'll talk about in a minute. So exclusion criteria within eligibility criteria is really meant to be exceptions to the inclusion. And so I tried to kind of think of some easy examples here. So in this one, I'm saying, oh, our population is elementary school students, and maybe my exclusion is not private schools or something like that. And then we're going to look at swimming, but not like organized swimming. So maybe this is more like the swimming at school or I don't know. Just not like an organized sport kind of swimming, just like maybe swimming more for fun. And then that gets translated into the search criteria, right? So what from there should I put into the search? So I kind of broke that down here. And then maybe if you had maybe they only wanted RCTs or a certain type of study, maybe that gets added in as well. But sometimes when I ask them for the eligibility criteria, they will give me more like search concepts, synonyms, that kind of thing that's more for the search. And so they will sometimes confuse eligibility and search criteria from each other. The exclusion labels, these are when they get down to the full text of what they're going to label studies they excluded, and that is what goes into the PRISMA flowchart. And so there's like one box when you're saying, oh, this is how many we excluded by full text. And then you'll see that list of reasons they kick things out. So I just made kind of generic things. It could be written in a little bit different way, but I tried to show in here where those criteria are in the flow of the work and what they mean. So I hope that this is helpful in explaining that. Let's see how we're doing. Let's take a Okay, so I have one question about for the scoping example, how would outcomes be reported if there are no study designs? So in scoping reviews, you don't have to have any one set of outcomes because in scoping reviews, it can be so much more heterogeneous. So it really depends on their topic if they were even looking at outcomes. So that's a good question. Scoping reviews can be really varied in how specific of a question they are. And then sometimes they do have, kind of outcomes, but scoping reviews are meant to be broader questions. Sometimes you'll see people kind of using a scoping review like a systematic review, but without the critical appraisal part, which of course are not required in scoping reviews. But sometimes you kind of see in PubMed, you'll see one that's like, this is really more like a systematic review that just didn't do the critical appraisal part in how they framed the question and how like narrow it is. So I hope that that helps. Okay. So now we're about halfway through. So I'm going to give you a little exercise, a little break here. So I'm thinking we'll take like a 5-minute break. But I wanted to show you, if you have never had a chance to go and check out this tool, it's called Write Review. And I put in here the link to it and also the article. And so what I would like for you to do is take a few minutes, and you can take our example that we used for the vitamin D one, and you could put one of those examples through and see kind of what you get. But I think it's a neat tool to go and look at it and see what it can provide and help with. So you know what's there. And so let's see. Right now it's I got 1:43. So what if we take 5 minutes? I'll come back at 1:48. Hopefully it gives you a chance that and also think through your questions. I'm going to try and see if I can't answer some more in the Q&A. But go and check this out and see what's there. There's also a glossary. There's some links about knowledge synthesis. So I think it's worth taking a little time here and thinking through if you have any questions about other slides. So I'll see you in 5 minutes. Okay, so it's almost been 5 minutes here, a few more seconds. So what did you think about this tool? Um, do you think it will be useful? How did it go looking at this question and trying it out in there? So you can type in the chat what your experience was. Awesome. That's good. Um, so sometimes I send my clients there by themselves, but a lot of times I will sit with them to kind of talk through some of it. I didn't know how to ask the right question to get a scoping review. So the scoping review, I think on the very first question, you might have to pick the last option on there. So if I remember correctly, it's kind of like effectiveness, harm question, and then kind of down at the bottom, they will have something about like summing up the topics or something like that in an area. Okay, so great. And to me, this has also been really helpful for the qualitative types of reviews because those are the type I gravitate towards the quantitative. And so when people have questions a little bit about the qualitative, it's easier for me to have them use this tool. So I'm glad that we took the time to give you a chance to look at those. Okay. So hopefully I've answered a lot of your questions that you had, but I did look through the chat while y'all were doing that, and I saw a couple of things I could talk about here, and then if you have more questions, feel free to write them in. I did see one kind of not really a question, maybe a comment, but I think it's a good thing to talk about. And that is when clients come and they have really like 3 questions they're trying to answer with one systematic review. And I have this, I see this often with some groups. And it's important to talk with them about do they have like a priority of one of those 3 questions, or do they understand that's going to slow them down? Because sometimes what they're really doing is they're trying to do 3 systematic reviews in one systematic review. And each of those questions may need a different search. Maybe they only need one search, but they're going to be treated differently after that. So I just try and talk through with them what I'm seeing kind of as an outsider. And sometimes they don't realize that they're making things harder on themselves, and sometimes they do, and that's that's their prerogative. But I just talk through with them, what does that mean? I had one recently where it was kind of, I think it was 6 different questions in one big project, and it turned out that 2 of those questions could be answered with one search, and then the rest could be answered with another search. And so we ended up doing 2 different searches, and then when they screened them, they marked them for which question it would match, kind of a thing. So there's different ways that you can approach it, but it's definitely good to kind of talk through what you're seeing. There was another question about clear expectations, and this is really important to kind of talk through those and what are clear expectations. So for example, one thing I don't do is I'm not going to do any help with the writing of other sections other than my part necessarily. Also, I'm not expert on their topic, right? So there's things I can't help with. The only thing that I will do is I will look at Prisma and I will see, for what I can understand, have you answered that kind of a thing? But you have to set your own expectations for what makes sense for you. And we're going to go over this and talk about examples of policies and things on our last day together. These first several sessions are more about like getting the process set up, and so you can see what it looks like, and then you can decide what you want to be able to offer your client. So I hope that that helps in that. Um, oh, I see. So in the right review was asking about if your review is about interventions or diagnostic tests, how many? The reason why it's asking that is there's a special type of review. I'm not going to have a lot of time to talk about that in here. That's called the network analysis, and that's how you would compare different interventions to each other. So that's trying to get at a very specialized type of review. So, okay. So I'm glad that you found that helpful. So let's move on to our next section here. And now we're going to start getting into some preliminary searches that you can run with your client. And like I kind of said before the break, depending on how long each of these steps we're talking about takes with your client, you might break up these steps in between different meetings. It just depends on you and your client. I usually like to try and at least get through the third step and give them some related reviews depending on their topic. Just because I found that giving them an exercise to do, like we're about to talk about, is usually very useful. Especially, I think there was one question saying, oh, they don't always know what a systematic review is. Having them look at related reviews to their topic can be really helpful to get them to understand the difference. So, okay. So when looking at related reviews, we're trying to do a couple of things. One thing is we want to help the client to see reviews related to their topic. And how is that scope related to what they want to do so that they'll know how unique their idea is. And sometimes, when you're trying to get published, they would like to know how does your work relate to others' work. So that's good. And it also helps, like if they're trying to say, oh, no systematic reviews have been done as specifically like this, or the last one done was this old, that kind of thing. And then these could also be used to try and find more included studies as well. So let's talk about some of these steps. So depending on their topic, there's different places for you to look. Of course, there's review databases, and I meant to have that one say Cochrane, so sorry about that. So there's the Cochrane collaboration, Campbell, you can also look there. Campbell collaboration is kind of a sister organization to the Cochrane collaboration. We're starting to see a lot more like done there around nutrition, education policies, and others. So it might be good to check that out if it wasn't like a clinical intervention kind of a topic. There's also databases of protocols like Prospero, the Open Science Framework, and we're going to talk a lot more about protocols next time. But these are places where you might go and see, oh, has somebody said they're going to work on that? I've worked with some clients that they were kind of halfway done with a review, and then they found a Prospero protocol from like a major group. I think it was something like a group from the American Cardiology Society or something like that. And so they were like, oh, should we change up what we're doing? Because they're working on one too. And so it's a good indicator of what others are doing, and it's good to be aware of them. It doesn't necessarily mean that you have to change what you're doing, but in this case, they decided to kind of lean in on what they were doing that was different from them. And that was my suggestion for them, because they were tending more towards qualitative and what they were looking at. So that helped them. Of course, we're looking at the subject-specific databases like Medline, PsycInfo, just, it depends on your topic. And then sometimes even dissertation or and thesis databases. This is especially true like with newer kind of those hot topics, and AI to me kind of fits in there. Kind of see what's coming up in there, and you'll see some newer things. So of course, when we're looking for reviews, there aren't as many reviews as there are primary studies, so you might not necessarily put in all of the eligibility criteria into your search, depending on how many things come up. If there's a lot of reviews coming up, you may want to be narrowed down to only looking at systematic reviews if you're doing a systematic review. But sometimes you have then, it just depends if you need to be more narrow, more broad. One area that can sometimes be very tricky, and I think I saw a few folks talking about topics outside of medicine. Sometimes it can be really tricky trying to find systematic reviews if they don't call it a systematic review in the title or the article. But here you're just trying to do your best to find those related reviews. So sometimes you might have to say not systematic review, but leave it at review, or maybe even overview, something like that. What I like to do from that, I will suggest to the team, to the author, the main thing that we're trying to get out of this exercise is to know, okay, what kind of review is it? And what was their scope? And so part of that scope could be, the framework, the PICO, but it's also like, where did they search and when did they stop searching? That gives you some indication of it's kind of like the population of that review in a way. And so it can let you know, for me, I ask them to show me that when we meet again, and then we figure out like where is what they're trying to do fit in. At some point, they're probably going to want to do an appraisal of those reviews. And towards the end of today, I'll talk about a little bit about some appraisal tools that are out there. But in this way, if they present this to me, then I can talk with them like, okay, the last review done was on this year. Looks like maybe they didn't search this database, so we know we're going to add that one in, kind of thing like that. And the other thing that this does is it gives them an action item to do rather than just say, oh, go read these. It's not as helpful to me than to just have them read it because they don't always focus on what's most important and what we need to move forward kind of thing. But having them look at these different kinds of reviews can sometimes be very helpful, but specifically the systematic reviews that they look at, I try and point out what's good in that review, what maybe needs to be done better, just to kind of show them those differences there. This is an example of a table that was actually published as part of a review. And so I think that definitely if they work on a table, they could consider publishing it depending on how many related reviews are out there. And so in this case, what the authors did in their intro is they tried to show, okay, here's the other reviews that are out there. Here was their focus, here was their methods, and here's what our review adds to the literature. And I find this to be very helpful as a reader to see how it relates. And of course, like all humans, I like to skip to the pictures. So this table kind of sums things up there. And so let me stop there and kind of see how y'all are doing. Let's see. Okay, so yeah, I was saying I had meant to change that to say the Cochrane collaboration. So there's two big organizations out there. There's the Cochrane collaboration, which is the Clinical Medicine Systematic Reviews organization, and that's what they focus on, the effectiveness of clinical interventions. And then they have a sister organization called Campbell, and I've done a lot of work with both, so sometimes I type one when I mean the other, but they work a lot together in their, like, looking at their standards. Sometimes they'll have meetings together, but Campbell focuses more on like social science for the most part, although we've seen them grow into other areas, and nutrition is one of those. So hopefully I didn't confuse you there, so sorry about that. Okay, so next we're going to talk about the scoping search. Depending on how many reviews we found in the last search, I might stop there and say, oh, I'm seeing a lot of reviews. that are kind of close to your topic, let's stop here. Let's have you look at those, look at their scope, see how it relates to what you're trying to do. And if it comes up like with hundreds in the search, I'll say, I'd like to send them that file. I'll put it in their EndNote, their RefWorks, whatever, or just send it as a table, whatever, works for them, and then have them sort it out. So I'm not going to be able to sit there and pick out the ones most relevant to them. But then depending on how many we get there, if I have time, then I'll go into the scoping search. Otherwise, this will be a follow-up meeting. And so in the scoping search, this is where you're trying to start to get an idea about how much stuff is out there, right? Because my second most often question after what is a systematic review is, how long is it going to take me? And this is where it can start to estimate that a little bit. And of course, we know the average is a year, although the latest I've seen is 16 months in talking about it. Of course, I've tried to do the search in the most important database to their topic, and a lot of times that is Medline, but not always. And I try to start recording things for them and using tools that we're going to use as we go forward. I have found working with and showing my client a Venn diagram to be very helpful in having them understand where I'm coming from and trying to develop their search. It helps to make sure like how I'm thinking about ORing things to be useful. Here I use population, intervention, and type of study, as that's how you see Cochrane setting up their search and their concepts. Of course, it all depends on the topic as to whether or not these would be your three things that you would put in here. And sometimes population has a term that needs to be added together. So if you have like an age group, genders, some other concept, and you're ending that with the health issue, that might be a different kind of diagram here. So like type of study is sometimes not included in the search. Sometimes I'll use color to help organize that when I show them the search. And so here is an example of how I could kind of color coordinate that and start writing out and ORing like the synonyms. I don't try and make this search the best search that there is. I don't try and make it super comprehensive. This is like a quick search. We're working together and we're seeing, are we talking, oh, your concept is so broad that's going to be, hundreds of thousands of articles, or, oh, that's really specific. There's not that many things, that kind of a thing. We're just kind of getting started. And so usually what I do from this is I would give them maybe the first 50 or 100 articles that we retrieved and start to have them talk about like processes and things like that. This is also a time when you could start testing those articles. Maybe they said, oh, I want to make sure these articles come up. I could test those on the search. And of course, I could take a closer look at those. We're going to talk a lot about search development. That's going to be the focus of our next section together, and talk about testing and all of those, everything around that. Hopefully you can read this okay. I know it's a little bit blurry. So this is like just an example of kind of a quick search. And so in this one, the question is, what are the attitudes of graduate students towards library instruction? And so this is just one take on it. And also this is an EBSCO search. So, they always show it to you upside down. So down at the bottom was what I started with. So my first search was putting in graduate students. And then I tried to think of different ways of maybe saying instruction. And then I thought, oh, what kind of studies might those be? Surveys. But I know somebody else looking at this question would probably design the search a little bit differently. And if I would show you this one when it was like full blown and done well, it would probably combine a lot more terms in here. But how would you search this differently? have some terms around attitude. Yeah. So a lot of people are talking about the time. Yeah. Um, so, uh, you know, I tell people what is reasonable amount of time, and then of course they can try and get it done sooner. But all you can do is try and be realistic with them. And if it has to be submitted for publication sooner, sometimes I show them there's other types that maybe they need to think about. But of course, they're the ones who have to do it. So we're going to talk about looking at terms and how to assess those and figure those out more in the next session. But yeah, so um, probably need to combine in those attitudes. I think when I was working on this one, I was just like, that seems like a big concept. I don't want to work on that one right now. So I was thinking about the surveys. But yeah, when we look at the full-blown ones, definitely we'll have those in it. Okay. And so the next part, like I said, is I like to give them like 50 to 100-ish and have them start sorting. We happen to use Covidence. Since we have a subscription to it, I used Rayon for many years. And then, of course, there's other options out there. And the main idea here is to have them start thinking about how would they sort these, and also to come back to you with hopefully some potential studies. So when I'm doing this process, I ask them, okay, you're going to sort these 50 or 100 that I'm giving you. Look at some things you've already collected. And the main thing that I try and emphasize with them is to say, please make sure that those things you're going to say, hey, these are relevant, are things that you would include. Because there is a difference between related, and I want to put this in my lit review or background or whatever of my review, and then included. And sometimes they get confused between those two things. And, seeing those related articles can help in looking at how they're indexed or something. But when I'm trying to test them against the search, I think it's most helpful to find ones that are actually like match everything that you're looking for. This also helps me to see when they are marking things, are they marking things that don't match their criteria? Are they not, are what they're doing is marking things that are very heterogeneous, and they said they wanted to do a systematic review. This is also a check for me to see, are they understanding that difference between systematic reviews and scoping reviews, kind of a thing. So a little chance there to talk about that. So in evaluating the results, we're just kind of trying to see like, what's the difference here? Oh, and I just realized on that last thing under found too little, I should have said increase the broadness of the topics or something is what I was trying to write in there. So if we found too little, we might need to change one of the concepts to be a little bit broader. So maybe, for example, if they were just saying like elementary school students, maybe we say all K through 12 or something like that. So they might need to play with one of their criteria. Usually when you look at a list of eligibility criteria, there's usually at least one of those items that is what's going to really bring down the numbers that you have coming back. And I don't mean that in a bad way. Having those terms be specific and what they need to be for that kind of review is important. But sometimes they are being way too narrow. So sometimes you have to broaden that. If they found too much, then maybe you need to go the opposite way and start thinking about how are we going to limit that and what makes sense. Okay. I'm almost to the last slide for this section, and I'll get to your questions. So then with the scoping search, sometimes what I ask them, especially for kind of struggling, this is mostly for that group that's struggling, but this can be helpful for any review at this stage, is to start kind of putting together a similar table to what I was talking about with the related reviews. I use this a lot when they're not sure what study design they're going to get back or what they should focus on, that kind of a thing. Or if they're trying to decide on trying to narrow. But having a table like this can sometimes be really useful for that. So let's see what's happening here. Okay, so somebody asked, for systematic reviews, do you recommend using a certain risk of bias assessment tool to analyze the studies? So we're going to talk about that when we talk about the protocol next week. It really depends on their type of study as to what makes sense for that. I'm sorry, I didn't include that, the citation for that one. It is from Dr. Booth, and I believe it's a Cochrane qualitative review. It's a very rare, but you're right. I forgot to put that citation in, so I can fix that. Oh, why not include outcomes in the feeler searches? So so the question is about why don't I include outcomes in my initial search? So sometimes they're looking for any outcomes, or maybe, it could be like very broadly, like did they get healthier or less diabetes complications or something like that. So then you don't want to be specific about your outcome in the search itself, because then you'd be narrowing things down unnecessarily. The other thing is Cochrane, for the most part, suggests not including outcomes. However, sometimes on those PEO questions, that's the population exposure outcome questions, if you didn't put the outcomes in, you'd just be overwhelmed with how many things you got back. And as long as that outcome is pretty specific, you're probably okay doing that. Outcomes can be kind of tricky in that way. And what's considered too little results, it's all relative, right? But if you only get a couple hundred back, you may not be able to get enough articles, and I put enough in quotation marks, to have a good area. For the most part, critical appraisal of studies and risk of bias, a lot of times people use those very interchangeably. But we're going to talk about that a lot more next time. Yes, the question is talking about the table that I showed is using PICO, and maybe they should use one that matches their question frame. And I would say, yes, that's very true. You're trying to get them when either table that I talked about, making one for the related reviews or for the potential included studies, it would be good to create a table that matched whichever framework best matches, because you're trying to figure out the scope and the study designs there. So we're using those as a helper. Okay. So now we're going to try to bring it all together now. And we're going to talk about the rationale and about bringing kind of the parts of the proposal. And remember, I said that this does not have to be formal. They may not be turning this into anybody, but all of this builds up into what needs to go into the protocol. And of course, what needs to go into the protocol builds up to what needs to go into the final product. One thing that I would like to say about time. So sometimes I have somebody come to me and they say, I've submitted an abstract to such and such conference. It's in 3 months. I have to finish this review before then. My suggestion, and that I will tell them, is don't artificially try and rapidly finish this whole review before that conference. Wherever you're at in the review process and you need to submit the presentation, the poster, whatever, that's what you'd submit, your preliminary findings of wherever you're at. Whether that's we finished the protocol or we screened 100 articles, whatever that is better to submit that and have that than to hurry up and try and finish it because that's not realistic and that's not quality work either. So hopefully that helps. So in putting together and trying to figure out, is this feasible? Of course, there's no like right way of doing this. I could just talk about like things to consider. So I think about the scope, I think about the time, and I think about the resources. So, very rarely, but sometimes there's teams of like 20 people to sort things. So maybe they're going to go through that faster, and maybe they're not as intimidated by like 20,000 articles or something like that. But of course, that would be really overwhelming to most people to have that many things. Did their question change? Did their criteria change? They've got to keep going back to that question, and everything needs to be based on that. Because what you're trying to avoid is the scope creep. And that's when they come to an article and they say, oh, this is by Dr. So-and-so. We have to include that. And then I look at it, I'm like, this does not match your eligibility criteria. Sometimes they will try and make something come in, and I will talk with the team about that. And I will talk to them about trying to avoid that the whole time. I have this less and less. A lot of the groups I've been working with in the last couple of years, we haven't had as much of an issue with this, but sometimes it's an issue, especially for maybe sometimes smaller teams, and sometimes maybe the more inexperienced teams, this will happen to them. So do you have what's needed? This follows the TREAD. And, oh, I just realized you can't see all of that. This is from Dr. Booth's book, and it's at the end when I show you what's on my bookshelf. It's also on there. So this talks about time, the resources, the expertise, the audience, and the data. And so I just have a couple slides on this. So, we talked a lot about time. I just try and be realistic with them. I have finished a few reviews in less time than a year. Most of those teams were very experienced teams, and we didn't have a lot to sort. So I just try and be realistic with them. But that's all that you can do. With resources and software, things like that, it depends on what you have available. There's all kinds of parts along the way and different processes where they may need different things. And then the main thing is, where you're at in your institution, and I try and work with what do we have? What do they already know? What makes sense? I talk those kinds of things. So this gets a little bit into data management as well. Depending on their topic, if they need like a meta-analysis person, it's good for them to start thinking about that because they may want to consult with them before they get too far into the protocol, because if they're not expert on that, they may need some more expertise in figuring out sometimes with that inclusion criteria. And that, of course, is not my comfort zone. So I just have a little bit about that on here. Okay. And then the audience, with some reviews, they try and get people like experts involved that are outside the project early on, to get some feedback on the protocol. I know I've had teams that do that. But it's also good to think about when they're writing up and going towards the end of this also, who wants to know this? What information would they need to know as well? And then there were some questions about like, well, how much is enough? There's no right answer. I've seen systematic reviews with 2 articles. I've seen it with over 100. There's really no right number, but sometimes the gatekeepers like journal editors or reviewers, sometimes they decide, oh, you have to have at least this many before we're going to include it, that kind of a thing. So the rationale, this is basically your reasons for conducting the review. This is where you want to talk about what those other reviews did and what you're going to do that's different. Of course, the importance of your topic. Maybe you include a table. And there's different tools for appraisal. This is not something that I necessarily give to the clients like way at the beginning because sometimes this is too much, and they're going to work on their review a little bit, and then when they come back and they're going to work on this part of it, that's when they can really get into it. But some other groups, I'm like, oh, they've got it. I like Robus, and that's the domains here that I put on the page. MSTAR is really good if they're looking at meta-analysis, and then the CASP one. So this is a critical appraisal of reviews. This is not the risk of bias tools that we were talking about that you're going to use when you're doing your own systematic review and looking at primary studies. We're going to get into this some more later in other sessions, but I did want to put a list in here so you could start looking at it. But we'll get into this when we get to session 4 more. Okay. I just wanted to mention logic models here. This is part of the Cochrane Handbook, and I did put the link in here, and you can go to that section to see it. This is not a requirement, but sometimes it helps me when I'm working with clients kind of in the beginning, just to draw some simple pictures about how they're relating factors to each other. Sometimes systematic reviews, they already have a logic model in mind, whether they write it down or not. And then sometimes they're testing it, or sometimes, like you might say with a scoping review, you're trying to develop the logic model. So it's just basically, how do you see this situation and different factors that you're looking at? And you can see more in that section. This is starting to be talked about a little bit more. It kind of went in and out of favor, it seems like, over time. But I just wanted to bring that up because if you have a group that's interested in this, Cochrane Handbook does have some suggestions for it. And then this is just my basic proposal outline. There is no like standard or anything like this. This is just kind of suggestion. Of course, it may not be PICO. It could be one of the other frameworks that we talked about. But basically in the proposal, you want to know, what is your question? What's the eligibility criteria? What's the rationale? What other reviews are out there? And then maybe even some example articles. And that's kind of where you can see, okay, this is where we're going. And like I said, this may not be formal or anything like that. But all of these steps will build into the proposal, the protocol step, where they're getting into more of the methods about how are you going to do this. And it's just the start. I just gave you all a lot of information, and we have about 5 minutes left here. I'm going to come back to this question slide. I just want to point out a couple of things, and then I'll do that. So our next session is going to be all about the protocol on the 24th. This is what's on my bookshelf, and that's Dr. Booth's book. If I had to hand any student a book about systematic reviews, I would give them Dr. Booth's book. It's really good. Qualitative, quantitative studies, medical, social science, all of those things. Of course, I put Sarah and I's book on there. And then I also put this other book from Levy and Craven on systematic searching. Very good. They wrote the chapter on example searches for me in Sarah's book. So I see some questions. So let's see, how are we doing? The time frame of, so there's a question about what's the time frame of published articles? What's best practice? Depending on who you talk to, I've had some people say, oh, Cochrane Collaboration says no year limits. I don't know that that's true. I think sometimes it does not make sense to go back to the beginning of Medline to find things. I'd say it is good to have a reason, though. Why did you pick those certain years? And of course, a lot of times people do like round numbers, or they do like to say the last 10 years or something like that. Sometimes it's because a certain situation happened, a definition changed. So it just really depends on your topic. That could be very changeable. So scope creep comes up. They suggest additional articles. I add them to the suggested references. Oh, that's a good idea. So they're saying, oh, we might think about including these, but maybe it doesn't make sense, but it's still related and you can still do hand searching. I think that's a fine way to go. So I hadn't thought about that before. Let's see, what other questions do y'all have?
Yeah, we're just about time for answer what we've got. So we're getting toward the end of the time here.
Okay. So hopefully I've answered most of your questions. And I know that there's some housekeeping things that Margie might need to do, but I just want to thank everybody for joining us today. I hope some of these examples help you. And I'm looking forward to our next meeting in about a month.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.